My name's Noel. I'm a psychotherapist, and I'm here at Onsite. Where are we? Where is Onsite?
Cumberland Furnace, Tennessee, about 40 miles northwest of Nashville.
Oh, I was in Nashville last night. I'm telling you, Nashville's really cool. This place is amazing. Absolutely beautiful, stunning surroundings. And I've had a look around. It's just being here, you just breathe in sort of life and health and healing.
I'm grateful every day that I drive from Nashville here
You know,
and just look at the
right.
beauty and the green, and I'm just lucky to be here.
I'm going to leave London and move in here. I think I've got my tent, actually. I might not go back. I'll pitch my tent up on the hill. And you've got a permanent resident now. Did you know that? You can't get rid of me. So you say that in London, you this thing called a bad penny. I'm going to be your bad penny. Bad penny always turns up, you know. You can't get rid of them. So what do you do here? Who are you? What do you do?
I am the clinical director of Milestones, which is our residential treatment program for trauma. And so we deal primarily with trauma that people have experienced and all of the things that are associated with trauma, which includes codependency, anxiety disorders, depression, post-traumatic stress disorder, process addictions, or compulsive behaviors that people engage in that become destructive in their lives, and what we call stage 2 recovery, which are people that have established to some degree sobriety in their lives from drugs or alcohol, for example, but they're ready to do that deeper work, usually around childhood issues or traumas or painful things they've been through in their lives.
That's one of the things that struck me about Onsite and why I'm excited to be here, is that unlike most addiction treatment services, you don't deal with that primary sort of alcoholism or drug addiction. It's the other stuff that you focus on, because usually what happens is, in most treatment centres, they'll sort of do the alcoholism or the drugs, and then almost as an afterthought, will do the trauma and the codependency. You flipped that here, and you deal with that as the primary issue. The sort of people coming with expressions of that trauma through these various sort of medicators, I suppose you might call them.
Yes, that's true. However, we also recognize that addictions are for the most part primary, and they have to be addressed first generally. For example, if a person is still struggling with drinking on a daily basis or a weekly basis, or they don't have any kind of solid sobriety in their drug use or any other destructive behaviors such as overeating, undereating, gambling, workaholism, sex addiction. We want them to have some kind of handle on that, usually because they become involved in a treatment program or a 12-step program. And then in order to support that sobriety, it's usually important for most people to deal with the deeper issues, the experiences that they've had in their lives, which may be the whole reason they were using those behaviors destructively to begin with, to separate or to numb themselves from that pain that they carry.
That's really clear, and I'm really excited by this idea of sort of understanding that these things are primary conditions. You've got to deal with the addiction, the primary issue, rather than it being seen as a secondary issue from something else. And then you come here, I come here, say, for example, or somebody comes here, they're sort of in recovery, maybe from their sort of using around something. What sort of things can you expect when you come here then? To what's the sort of program like?
Well, our program is very rich. We offer the therapies that have shown to be the most effective in treating trauma. We know and we believe that the majority of symptoms that they call psychiatric symptoms, or that we call psychiatric symptoms, are usually embedded or related to or direct manifestations of traumatic experiences that people have had. There's new research out there that shows that the brain actually stores traumatic experiences in a whole different part of the brain. And as long as those experiences have not been addressed or healed at a cellular level, they can create all kinds of symptoms in a person's life, all the way from flashbacks and nightmares to being generally agitated or mistrustful or hypervigilant, to needing to engage in those behaviors we were just talking about, those compulsive behaviors to try to numb themselves. We know that most anxiety and depression, which is carried in the body, has to do with traumatic experiences that haven't been healed.
And how do you treat people? What are the sort of methods that you use here?
Well, we offer 3 times a week. We offer a lecture because we want people to understand why we're approaching things the way we are. We want them to understand how they got where they are and what their symptoms actually mean. It doesn't mean they're crazy. It doesn't mean they're feeling sorry for themselves. But we want them to understand exactly how those traumatic experiences they've had are manifesting and why. And also why, because understanding it, reading about it, having insight about it is not enough. We actually have to do deeper work that involves the whole mind and body. Examples are eye movement desensitization and reprocessing therapy, something we call brain spotting. We do mindfulness and meditation. We do connected breathing. It's amazing how many feelings and how many emotions can be released from the body just by breathing correctly.
Just remember, you just reminded me to breathe, which is always a good reminder to go. You know?
Well, you know, the first thing a child does when you tell them not to feel that feeling, don't be angry, don't be sad, is they hold their breath.
That's absolutely true.
So a lot of us adults walk around all the time holding our breath. We don't even realize it. So it keeps us cut off from our emotions and our heart and our body.
It's interesting. I mean, the thing about, I mean, these videos are meant to be quite short, but I'm really going to get into this one if I'm not careful. So, but I just want to underline this point about why do we as a species remember trauma? And it's really important to understand this, that we remember it because we've learned through history, if you like, going way back in time, that if we remember the trauma, then somehow we're going to survive it in the future. And it's encoded genetically as well. It's really important to understand that doing this type of work is giving somebody the opportunity to reset that and to, if you like, start at year zero again and go, this is the way I want my life to be from now on, rather than patterned by sometimes dreadful things in the past. So, and
what we're meant to do is experience whatever we experience, and we're meant to learn from everything we experience, but we're not meant to suffer forever. And when trauma gets stuck in the brain and stuck in the body, that's what happens, is people just keep suffering and keep suffering and keep suffering, or they continue to see it or feel it or think the thoughts that go with the trauma. And we want them to be able to remember their trauma, but we also want them to have relief and ultimately wisdom from what they've experienced.
No, I don't mind. I hope you don't mind me pointing out your reaction. When I started talking about, I saw your whole body shift. I saw you shift. You shifted a gear. And I could see how passionate you are about this stuff. You were right in there, which was absolutely awesome to see, because that's what you're going to get when you come here. That, you know, we can have these really corporate, bland conversations, or we can have real people just go, actually, no, this is what it's about, and I'm really passionate about this. And that's actually, I think, that passion, that commitment is also what heals people when they come here. As well as, clearly, you know what you're talking about, right?
I know it not only because I've studied it and I've been in the field for 30 years, but also because I've done my own healing, my own work, and I know how much courage it takes.
Why would you not want that?
We believe that our clients have tremendous courage, and most of us have walked that walk as well, so we can truly help them, not just from our heads, but from our hearts.
Well, that's the combination that works, you know, a fantastic place with a great team of people, lots of personal history, lots of understanding, deep understanding of what works, and a human being who's walked the walk. Amazing combination. It's so inspiring being here. Thank you so much for your time.
Thank you so much.
So bye-bye, London.
Bye-bye, London.
See you again soon.